We're continuing our discussion of behavior therapy, and in this lecture, we'll be talking about the therapeutic process. So, what does behavior therapy actually look like? So, the general goals of behavior therapy are to increase personal choice and to create new conditions for learning. So, rather than having people, I guess, kind of fall into behaviors by chance, this type of therapy is focused on having you choose the behaviors, make conscious choices about the behaviors you want to engage in, and also creating new conditions for learning. So, creating learning experiences that bring about the behaviors that you want to display. As we've already talked about, formal assessment takes place prior to treatment to establish baseline levels of behavior and to determine behaviors that are targets of change. And then there's continual assessment throughout the treatment process to see if those behaviors are changing. The client plays an active role in formulating goals, and the goals must be clear, concrete, understood, and agreed upon by both the client and the counselor. And then, you assess your progress toward those goals throughout therapy. So the therapist's role is to identify conditions maintaining the behavior. So as we said before, the focus is on the current conditions, the current environmental factors that are maintaining the behavior. And so the therapist helps identify those conditions. And they may do that through a functional behavior assessment or functional assessment or behavior analysis. And this is identifying the events that occur before the behavior that contribute to the behavior. The behavior is then clearly described, and then the consequences that can be influencing that behavior. So A influences B, which then results in C. So the A part of this ABC process are antecedent events. So these are things that precede, that come before the behavior, and these antecedent events cue or elicit the behavior. And so antecedents can be things that are internal. They can be things like feeling depressed. So for the sake of this example, let's say that the behavior is overeating. So then the antecedent events that contribute to the overeating behavior could be things that are internal. So it could be when I feel depressed, I overeat. When I feel stressed, I overeat. When I feel lonely. So those could be internal factors that lead to the behavior of overeating. The antecedent events can also be things that are external. It could be things like when it's the weekend, I overeat. When I'm socializing with friends. When my boss says something to me that is hurtful. Or when I have a very busy day at work. So the therapist can help the client identify what comes before the behavior that could be eliciting or bringing about the behavior. Then next you want to clearly identify what the behavior is. What is it that the client is doing that is problematic? And then once you've defined the behavior, you can look at the consequences. What happens after the behavior occurs? And this could be things that are internal or things that are external. So it could be after I overeat, I feel very guilty, or I sleep a lot, or it could be something that's external. When I overeat, my partner gets upset with me because she knows that I have these certain goals and she knows that this behavior is not in keeping with those goals. So a consequence of me overeating is that my partner becomes upset at me. So you want to identify everything that is helping to maintain the problematic behavior. In this type of therapy, the therapist is usually very active and directive and functions as a consultant, so rather in a problem solver. So rather than taking sort of a backseat role, like think about like person-centered therapy, where the focus is very much on the therapist sort of playing a backseat role and trusting that the client has the tools they need to change their behavior themselves. So as opposed to that very non-directive approach to therapy, behavior therapists are much more active and they're in there working, collaborating with the client, consulting, and helping them really figure out how they're going to change that behavior. You create a collaborative working relationship with the client, and warmth, empathy, authenticity are necessary but not sufficient for change to occur. So from this perspective, they recognize that you do have empathy, you do have to be warm, you do have to be genuine and authentic, but that alone is not going to change the client's behavior. You have to have some type of intervention. Just being, a warm, accepting therapist is not going to do it from this perspective. So what does a client experience when they're in behavior therapy? So they can expect their therapist to teach concrete skills through the provision of instruction. So they'll educate you about the skills or the behavior that you're trying to exhibit. They'll use modeling. So they'll show you. So it could be them modeling the behavior. They could have you watching videos or somebody else showing the behavior that you want to see so you can model their behavior. And then they're going to give performance feedback. They're going to have you show the skills that you want to display, and they're going to give you feedback on how well you're doing. So let's say you're in some type of career counseling and you were trying to perfect your interview skills. They may, number one, educate you about interviewing. They may then have you watch some videos of people interviewing who did well. Or they may demonstrate, acting as the interviewee, demonstrate a good interview. And then they'll have you go through a mock interview and give you feedback on how you did in that interview. The client is expected to do more than simply gather insights. They need to be willing to make changes. So this is not the type of therapy where you're going to go and sit on the couch and just have internal changes. Your therapist is going to expect you to really show some behavior change and get out there in the real world and demonstrate these behaviors that you've learned and practiced in therapy. And clients will engage in behavioral rehearsal with feedback until skills are well learned. So in the course of therapy, again, you're going to be playing out, demonstrating those skills that you want to apply in the real world, and you're going to be getting feedback from your therapist until you really have perfected those skills or improved those skills that you're trying to develop. Clients will receive homework, so you'll have things that you'll need to do outside of the therapy session. And clients are encouraged to experiment for the purpose of enlarging their repertoire of adaptive behaviors. So you're going to be asked, or the client's going to be asked, to go out and try some things they maybe have not tried before, do some things that may be a little bit uncomfortable. Again, actually displaying the behavior and finding out which behaviors are most adaptive for them. As far as the relationship between the therapist and the client, so behaviorists recognize the role of the therapeutic relationship and therapist behavior as critical factors to client outcomes. So they recognize that you have to have that strong therapeutic relationship, and the therapist does need to be warm and empathic and genuine. But as we said before, warmth, empathy, authenticity are necessary, but are not sufficient for behavior change. You do need to have some interventions, which is what we'll talk about in our next mini lecture.